The purpose of this presentation is to present an ethical dilemma that is occurring in the clinical areas, in this case, unfinished nursing care, and demonstrate an ethical decision-making process to potentially solve the problem. The Institute of Medicine questions the gaps between the care that is ordered to be delivered and what is actually being delivered. The phenomenon of unfinished nursing care, which is judgment by the nurse of what care to complete and what care to leave, is a problem that does not align with the 6 aims for improvement. The IOM 6 aims for improvement ensures that care is safe, effective, patient-centered, timely, efficient, and equitable. Unfinished nursing care is actual care that was withheld or not delivered to the patients in hospitals. Nurses use clinical prioritization to decide what care will be completed and what will be left undone. Half to all nurses missed or failed to finish at least one care activity during their shift. The top 5 areas of missed nursing care are ambulation, attending care conferences for the patients, oral care, timely medication administration, and turning of the patient. Unfinished nursing care can be detrimental to the patient, resulting in falls, hospital-acquired infections, pressure ulcers, and increased readmission rates. In addition to safety issues related to unfinished nursing care, it is also associated with patient satisfaction scores. It has been identified that time constraints and shortages of nursing staff are the culprit of unfinished nursing care. Decisions about staffing need to be evidence-based, and if institutions make the decision on not to adequately provide enough resources, and rationing of nursing care is likely, then the staff need to be supported on their decisions to withhold care. Across the literature, there seems to be a discrepancy in how management and the staff view appropriate staffing. Oftentimes, management will see that staffing is adequate according to their needs, however, the staff does not. This is a constant struggle between these two groups, and in order to start minimizing the problem of missed nursing care, this needs to be addressed. The relationships between leaders and followers must be discussed. In order to have high productivity and positive outcomes for the patients, the two teams must agree. The literature suggests that there are differences of perceptions on these two groups, such as nursing staff feels staffing not adequate, whereas managers felt units are adequately staffed. The Donabedian model for quality of care is a structure, process, outcomes framework in which the organizational structure or characteristics influence the process of care, which represents the transactions between the providers and patients throughout the delivery of care, and then the process of care influences the outcomes of care. When care is missed, or the process of care, it is identified that patient outcomes are affected and will have a negative experience of the care. When the nursing staff is not sufficient to meet all the needs of the patients, it's the responsibility of the institutions to address these challenges ethically and clinically instead of making it the sole responsibility of the bedside nurses. Unfinished nursing care is not just the responsibility of the nurse. It is impacted by many disciplines, and it has been identified that nursing science alone cannot develop a sustainable solution to lack of time. Using knowledge from engineering, information technology, psychology, ethics can help in creating workflows to increase these efficiencies. Nursing time is a resource within the healthcare ecosystem, as previously seen. Unfinished nursing care is a socio-ecologic problem between the allocation of scarce resources and high-quality health care. Nursing time has been identified of not being sustainable, and it risks not meeting the needs of the present and future generations. These generations are at risk for unable to meeting their needs. Managing nursing resources is critical not only for today, but for tomorrow. Unfinished nursing care is not just the responsibility of the nurse. It's impacted by many disciplines, and it has been identified that nursing science alone cannot develop a sustainable solution to lack of time. Using knowledge from engineering and information technology can help in creating workflows to increase efficiencies. When making a decision, we have to identify the problem. Is unfinished nursing care? Yes, that nurses are stressed and overworked. Patients are not satisfied. They have poor outcomes. They are getting injured. Stakeholders involved are patients, nurses, leadership, and the whole hospital. And our options are collaboration of multiple disciplines to improve workflows and increase the efficiencies. Using the belief decision-making framework can help guide us in our ethical dilemma solution and determine if it is good. The first step in the belief decision-making framework is to determine what is fact and what is fiction. In this scenario, we know that unfinished nursing care does affect patient outcomes in a negative way. We do know that nurses do not have enough time to perform all the care ordered. Fiction is staffing is adequate per management. The next step in the belief model is to identify who the stakeholders are. Stakeholders would be the ones who are directly affected by this. Patients, nurses, ancillary staff, and leaders, whether it is management or leaders of the institution, are all affected by unfinished nursing care. The next step in the belief model are factors that unfinished nursing care does not align with the nursing code of ethics. It does not align with the nurse's responsibility of taking care of patients, responsibility to the healthcare environment, keeping the interests of the patients as top priority. Nursing has the obligation to promote health and provide optimal health care and promote the rights, health, and safety of the patients. One of the proposed options for solving this ethical dilemma of unfinished nursing care is for nurses to identify and implement innovative ways to improve workflows through team-based approaches. Changes that shift the focus of nursing care from mine to ours, and does align with the ANA Code of Ethics to improve the work environment or work setting. This means that nurses can create workflows within their department, and instead of taking on care individually and being the sole person responsible for that care, they can come up with a team-based solution on their unit so everybody can work together in order to provide this care so it does not go left missing. Once we come up with options for solving the problem of unfinished nursing care, we can see if it passes certain tests. Mom and dad test, professional test, or the harm test. With the mom and dad test, we can ask ourselves if mom and dad would approve of this nurse-led intervention to solve the unfinished nursing care dilemma, shifting the responsibility of my assignment versus our assignment in the unit. Another test we can work through is the professional test. What would the nursing committee say about this option? Would they approve of the nurse-led intervention in the workplace and try and troubleshoot ways of working as a team to minimize or omit unfinished nursing care? We can also take into consideration the harm test and ask if this option causes less harm than the alternative of what's been going on. And can this solution reduce the care being missed by using a team-based approach, or would it cause more harm? With the ethical dilemma of unfinished nursing care, nursing must empower themselves and implement nurse-driven, team-based approaches that can shift the work of mine to ours. Coming up with nurse-led, innovative solutions can help reduce the unfinished nursing care and reduce patient harm and help with the overall well-being of the patients. Until big changes can be made in healthcare, nurses can uphold the Code of Ethics for nurses by taking action and making decisions about providing optimal care to the patient. In conclusion, unfinished nursing care is an ethical dilemma in healthcare, and nursing time is a scarce resource. Until big changes could be made systematically
or within a nursing professional in general, nurses must come up with workflow solutions that can avoid unfinished nursing care and avoiding harm to the patients.